So I'm really happy to be here. This is an exciting event. Things like these are events that we can all be proud of, and it says a lot about Montgomery County that we're doing this. I knew when we were coming out of COVID, the message we got from the folks who were providing food in the community was the lines weren't getting any shorter. And I feel pretty strongly that COVID unveiled a hidden problem in this county that existed in a much greater depth, and the lack of access to grocery stores made it even harsher for people to realize, to experience. And I want to remind people, these are working people, and these are people whose wages are not sufficient to pay for food and pay for rent. And that if there are any conservatives in the audience who think we're doing a terrible thing by feeding people, all you got to do is support higher wages. These kind of programs only exist because of the substandard wages that too many people in America make. And that's the raw truth of it. Decently paid people who can afford to pay rent and buy food don't need to be in a program like this. But we have programs like this because I live in a county, and we all live in a county that's decent enough to say we're going to make sure that people eat. And this is one of my favorite things about governing in Montgomery County, is knowing you can support this kind of work, and it's going to be supported by the bulk of the people in the community. So I want to thank all of you for being here. You represent a much larger community that understands what we do and why we do it, and that's important, I think, to put up front here. This doesn't happen everywhere, as has been noted. We recognize the value of Fresh Funds program in fostering food sovereignty, for promoting residents' choice and dignified, safe shopping experiences. Another thing we struggled with in COVID was, for a lot of people, standing in line to get a box of food was not the same as being able to go to a store and pick the food out yourself. And so it does add a measure of dignity to what we're doing here. And it's important for people to not feel that they're too afraid or too uncomfortable to go and get assistance and get the food they need because of the mechanism that we use. And so this is important that we're doing this. We're offering pickup and delivery. It creates more flexibility for people. We have food deserts to not the extent that a lot of other places do, but transportation obviates the need for calling something a food desert. If we can get people to the grocery stores where they can get the food from the grocery store to people, then you don't have the problems of food being isolated from where people live. And the option of multiple retailers is really important, because the breadth of products that people can get is more reflective of the kind of choices that consumers want to make. So we want this self-sufficiency to also have the dignity of knowing you can get what you need, and you can get it from different stores if you shop in different places. But I really appreciate Sprouts doing this. I mean, I was up here for your opening, which was part of the opening of the center. This center is one of the most important things that we got done in my administration. We took this desert that was closed and got it reopened and got a grocery store here, which is what people wanted. So I'm really happy to be here doing this, because this is kind of a special place. And I actually once lived up in Burtonsville. And as Heather pointed out, the limits on free and reduced lunches and on SNAP benefits leave a lot of people who need assistance out of eligibility. This is another place where the federal government could help in raising the limits on people's incomes to match what people can really afford to pay. And I think it's a time to think about what the limits need to be in different jurisdictions, because if you're in a part of Maryland where the average rent is $700 a month, your income goes a lot farther than a place like this, where your typical rents on the low end are $1,500 to $2,000 a month. It's a very different world, and the benefits ought to be tailored to the different parts of the world that people live in. I want to thank OFSR and DHS and their leadership in creating this program and getting it out there. And I again want to thank Heather. I appointed her to this job because I knew she had a vision, and she would not settle for just doing what we've been doing before. I did not want an administrator who was happy to administer what we were already doing. I wanted an administrator who could think about what we could be doing and what we should be doing and make those things real. And this is a great example of something that she's made real. And I just want to acknowledge the work you did. So there are lots of other things happening. We've got additional support programs through MCPS families, including school-based food assistance programs, food as medicine program, and I want to say I saw Kaiser talk about food as medicine. The first time I noticed a normal mainstream health group actually talking about food as medicine. So I think this concept is beginning to take hold, and as anybody who has diabetes knows, your food is your problem. And it's either your medicine or it's your curse. And that's, I have to deal with this, and so I recognize what it means. And so food really does play a role in a person's health. This program's already had a tremendous impact. 600 families, $76,000 in the first month. We're sure we're going to grow, and we're going to use all 1.8 million of this. There's no doubt that we're going to get this done. And we will continue this, as we have with food funding. As long as there's a need, I'll continue to put money in the budget to address that need. I'm not going to walk away from people knowing that they can't put food on the table. And as a school teacher who had to deal with kids in Montgomery County coming to school where their last hot meal was on Friday afternoon and their next hot meal was Monday morning, and you see the stress that puts these kids under when they're supposed to be sitting in a classroom and their bellies are hurting, you cannot be an effective student if what you're thinking about is when I'm going to eat again. And so this is not just good for people's health, it's good for the children's mental health, and it's good for their performance in school. So this has multiple positive benefits that we ought to be proud of and we ought to be talking about. So I'm really appreciative of the governor's focus on ending childhood poverty. It's closely aligned with our goals. He demonstrated that through the creation of the Governor's Office for Children and enough initiatives to address poverty, childhood poverty. And I want to thank Maryland Department of Health and Human Services for quickly activating the Sunbucks program to support families while school is not in session. So there's a lot here to be proud of. There's a lot of people who've done an amazing amount of work here. Without the support from places like the legislature, the county council, programs at the federal government, we don't get to do these things. And without a leadership team that I have working in the county, this stuff doesn't happen. So thank you all very much.